Okay, we're going to do a podcast for the nervous system assessment and the chapter on stroke. I do apologize. I was not feeling very well this morning, so we had to cancel class. So the plan is you will have the podcast to listen to, and we will take your test next week as scheduled and stay on track. With that being said, I also have a date for your final exam, which I will give you next week. So I'm skipping a lot of the pathophysiology for the nervous system. You guys have it there at your access if you want to review it. The biggest thing with neuro is knowing what side of the brain controls what, because that's how the signs and symptoms will present on assessment. So knowing the cranial nerves and the number, name, and how to assess it is very important, and it is something that you have to know. And I'm not going to go through all the cranial nerves on the podcast, but it is something that you need to know for your test. So we're going to start here, and this is a diagram that is used. This is usually used when patients come back from OR. That's kind of my biggest example. If they've had some kind of spinal or epidural anesthesia, they use this as a guide. It's the dermatomes, which are sensory fibers, and it allows you to assess the sensation, because we want to know if the effects of the anesthesia is wearing off. So say, for example, a patient comes back from OR, had a epidural, we would want to document that patient has positive sensation S1 up to L1, for example. So that means they can feel me touching, or they can feel sensation in both legs all the way up to their hips. So you would document that, and it's a guide that you can use. This is one diagram in your textbook that covers all of the cranial nerves. It gives you pictures. Sometimes if you're more visual of the picture, I think helps you identify what cranial nerve one is affecting, and then that can trigger how you would also assess it. Plus it shows you in this picture, I like it because it shows you the location in the brain of what you are assessing and where that cranial nerve lies. So remember, you do need to review your cranial nerves in the textbook. 1 through 12, you need to know the number, the name, and how you would actually assess that cranial nerve. Now we're going to talk a little bit about the effects of aging on the nervous system itself. That's on page 1344, and I think there is a box on 56-4 is what I have wrote down. So a few things that happen with the elderly patients: they typically have a decrease in cerebral blood flow. So that will alterate mental function. This is why in simulation we talk about how it's important to assess orientation status. Are they alert and oriented ×3? It is possible they will be in the morning, but if nighttime comes, they may get a little more disoriented. They may have something called sundowners, is what most nurses call it. It may also be that we need to assess their orientation status because maybe a medication made them a little loopy. Ambien is notorious for having effects on the elderly population and making someone who is perfectly alert and oriented very confused and do things that they normally would not do. The other thing that can happen is a decrease in efficiency of temperature regulation, so they can have an inability to adapt to their environmental changes. A lot of times you probably have heard elderly patients, you may have heard it in a nursing home, they're always cold. It can be 90 degrees outside and they have on 2 sweaters. The other thing happens is they have a decrease in the actual myelin, which will cause a decrease in reaction time, so they're not quite as quick to react to something that happens. I like to use the example of, we've all probably been behind an elderly person driving and they're driving really, really slow, putting along, or sometimes they don't have the quick reaction time if something darted out in front of them to hit the brakes and could cause an accident. The other thing that happens is they have atrophy of the taste buds, so we need to make sure that for these patients we're assessing malnutrition in these patients.